Welcome to Health Focus. I'm your host, Dr. Scott. And as we enter 2020, we're going to focus with 2020 precision on health and fitness because it's a new year, and this is important to all of us. Whether you're dealing with it yourself or with your family, we all want to be fit and healthy as the new year is upon us. In fact, the federal government is tracking this, and the Affordable Care Act has specifically outlined the importance of public outreach and education for health and fitness. So that indicates to me that this is not only important for your health, but it's an economic issue for all of us because the healthier we are, the less we have to use in terms of health resources. And so it's really good any way you look at it. And we're really fortunate to have with us today my friend Justin Gray, who's a lifestyle and fitness coach and who's been doing this for a number of years. I should say that Justin has been a friend of mine. He's actually even coached my wife, who's been a powerlifting competitor, thanks to your expertise and training. So welcome to Health Focus.
Thank you, Dr. Scott. Thank you for having me on.
So this is the time of year, right, when people want to get fit. How did you get into this field?
Yeah, I've had a passion for human performance and nutrition as long as I can remember, but really over the last 10 to 12 years have made it my profession. After the economic downturn, I used that as like a springboard to start something new and decided, okay, I'm going to take all that passion and put it into something I really enjoy doing, and led me to where I'm at now. So been 10 years currently with UFC gym, and keep on going.
And UFC, of course, has an excellent reputation. It's a place where people can train either for fitness or if they're interested in martial arts or boxing, they
Correct.
can do it there.
Correct. We have a very unique model in the sense that I get to work with athletes, elderly, rehab, any kind of thing you may think of, fitness or health related, I can be a part of. Yeah,
we don't endorse specific businesses and so forth on this show, but I think it's important people at least know that they can reach you there if they want to get in touch with you to discuss these issues.
Correct.
And of course, we're not just talking about fitness, we're talking about fitness and lifestyle. So when you're dealing with these issues, you really have to look at the whole person, I imagine.
Totally. Yeah. I mean, every person, and it's what I enjoy about the profession in helping people, right? It's a very rewarding job, right? You get to help people, maybe avoid a surgery, get off medications that they've been on. But it's also, it's a taxing job as well. And not everybody comes to you, in the best place, whether it's physically, mentally. You see a lot of different people, but an enjoyable part is each person is its own unique problem, and it's kind of my job to figure that out.
So your clientele, does it come from all different age groups, or?
Yeah, I mean, currently I work with children as young as 7 to 8. They have the attention span to be able to, stay with me for 45 minutes to an hour, all the way up to some of my oldest clients are in their late 70s. Some are coming off of surgeries and rehab. Others are just quality of life. They just see that their health is something worth investing in, and they're actually some of the best clients to work with.
So Justin, how do you go about setting goals with your clients?
Yeah, that's very unique to the person. I mean, it could be as simple as someone who's needing to lose 20, 30 pounds. It could be some type of athletic endeavor that they're looking to accomplish, first 5K, 10K, marathon, whatever it may be. But it's unique to the person, and we'll set out a timeline, minor goals to achieve during that time to kind of build up to their ultimate goal.
And do you see the people back on a regular basis?
Yeah, I mean, it's kind of, if you want to look at it as like learning a new language, right? The more you spend with somebody, more time you're with a coach, time in the gym or doing your craft, you're going to get to those goals a lot quicker. So the more often we can have somebody in, the more successful they're going to be.
I imagine there's kind of an intake process where you assess maybe a little bit about their nutritional or fitness history.
Definitely, yeah. I mean, the first few times we meet, that's basically, if we're doing our job correctly, that's what we're doing. We're finding out what has they been doing in the past, right? How long has it been since they've been fit, right? Different things. Do they have injuries? What do they do for a living? Are they spending 8 hours sitting and another 2 hours commuting? Like, that tells me part of their story, and I know for things to look at, right? That's going to have a big effect on their mechanics and things like that. Of course, nutrition, sleep, right? Those things are all things that we monitor very closely, and that's really where the conversation starts, right? Are they getting enough sleep? Nutritionally, what are you doing? We're going to put them on a plan for that. And I don't care what the end goal is nutrition is going to be a huge part of that, and it comes with every program. Then we can actually talk about the mechanics and how we're going to get there.
And I guess this time of year, a lot of us have overindulged during the holidays, and so nutrition really does become central.
Definitely. I mean, now times, I mean, it starts, around Halloween, right? Where we have more engagements to go to. There's parties. There's food that we typically don't eat around. People are going to parties, for the holidays. So we need to manage those kind of expectations through those couple of months, but also to remember that it's a handful of days out of a couple of months, and we don't need to get what we call like a food hangover, right? Just because we went to a holiday party on Saturday doesn't mean that it needs to take till Tuesday for us to get back to a normal eating pattern.
Right. And of course, this is a big problem in the United States, where we have about 2/3 of adults being overweight and a third, in fact, being obese. So that's a problem. And from what I've read, I believe that people don't gain weight so much gradually throughout the year as perhaps 1 pound every year around the holidays, and then over 30 years you gain 30 pounds. I guess it varies from person to person, though.
Totally. It totally varies on it. But I think that's a benefit to working with somebody and being with a coach, is having that accountability of someone to kind of, tell you to your face that, hey, let's kind of minimize that so that doesn't happen over time, right? A lot of the people that we come and see, that this is not something that just happened overnight to them. Like you said, this is something that's happened 10, 20, 30 years down the line. And we have to remember that it's not going to happen. We're not going to reverse that in that same amount of time, right? We're going to have to take our time, start slow, and get back to, kind of neutral, if you will.
Right. And you mentioned sleep, which is, of course, very important. You mentioned nutrition. Let's turn to exercise now. Do you tend to focus on aerobic exercise, strength training, or a little bit of everything?
Yeah, I mean, again, it's going to totally depend on the person's goal, but first and foremost, if we can exercise as much as we want, but if we're not eating right, you can't outwork a poor diet, right? So that sleep and nutrition factor will be key. But then getting into exercise, we like to kind of have a holistic approach, right? We'd love to see people lifting weights a couple of times a week, doing something aerobically, right? Having them move at just a steady state, 30 to 60 minutes, right? Elevating their heart rate, but not something that they're killing themselves. And then maybe one time a week, depending on how fit they are, getting into that anaerobic state where they're really elevating their heart rate, getting that heart rate up 80, 85, 90% of their max heart rate. But that would be something for a very short amount of time, a couple of minutes to 20 minutes if they were very fit. If they can get that done in a week, good things are going to happen, right? As well as the nutrition and the sleep being a part of it. And of course, nowadays, trying to maintain or at least minimize some of their stress.
Right. And I guess since we're talking about exercise and so forth, it's important to point out that on occasion it might be prudent to at least suggest that someone first see the family doctor to make sure that everything is okay before starting an exercise program.
Of course. We always want someone, especially if they've been out of the gym for a long time, to consult their physician. Any of those things that the physician is going to look for, a little bit of movement. I've never had a doctor come back to us and say, hey, don't have this person move unless there was something seriously wrong. We're going to start them slow anyways. So being with a good coach is very important, and just knowing that, hey, we're going to start you slow. Yeah, we're not going to hit this thing.
Right.
And I think we see a lot in that is like people are motivated, especially around this time of year, and they go from nothing to all of a sudden, now I'm working out twice a day or 7 days in a row. And it's kind of our job to kind of pull them back a little bit, even though they are very enthused, and we want to kind of harness that, hey, let's start slow so injuries don't occur or we don't get burned out too quickly. But yeah, to your point, definitely checking with a physician, but with the right coach, they'll start you slow so we can check it from all angles.
From the medical perspective too, our thinking has really changed on this. For example, it used to be that cardiologists would recommend that people after a heart attack go to, if you can believe it, I'm talking in the 1950s and 60s, to bed rest, complete rest, so as not to put any strain on the heart. Right. And then over time in medicine, we came to realize that to the contrary, you really want to exercise even after many significant illnesses. And so now there's post-cardiac rehab where people will enter an exercise program even after they've had a mild heart attack to try to build up the remaining heart muscle. But typically the approach is to do so very slowly and cautiously, but nonetheless, thinking about conditions where a person really should not exercise at all, it seems to be getting to be fewer and fewer conditions. Even after surgery,
Totally.
we get people up and out of bed. Used to be after surgery, you stay in bed for a few days. Now we try to get people up and out of bed to prevent complications of being in bed, like muscle wasting, bone loss, infections, pneumonia, etc. And so I guess that reflects the general medical perspective that exercise is good. And I guess that's what you're describing.
Totally. I mean, I see a lot of clients that are coming from, post-surgery, and we have them in there a couple of days right after surgery just to get them moving around, right? I mean, again, it's not something that's strenuous, but getting them moving in the right patterns, right? And just mentally, how much does that help instead of being in pain and sitting at home? Hey, let's take your mind off of it, get moving, feel better. The recovery is so much faster when it's done correctly.
How do you overcome the inertia when somebody just doesn't want to start exercising? Is it usually a relative or?
Yeah, I mean, it's tough. Everyone kind of has their own story. Kind of liken it to, quitting smoking. They're going to have to be the one that wants it. I can be as enthusiastic as I can be, but if they don't really want it, it's going to be a hard road, right? We'll try and pave a path for them to get them there. And I think sometimes seeing that path and saying, hey, let's make some small-term goals. In the next 4 weeks, if we can get you to lose 6 to 8 pounds, how is that going to make you feel? Right? Once people start to see some weight loss coming off, or they move better, they feel better, they don't have the pain they used to, all of a sudden now that's motivating. So sometimes it's just getting them in the door and just getting them started on a plan and saying, hey, you're following the plan. Look at what's happened. Imagine if we continue this plan, how you're going to feel.
So let's start with stretching. Do you have your clients stretch before they start working out, or do you have them do a little light workout first to warm up?
Yeah, it kind of depends on the coach and the client again. But a lot of times with my clients, we'll do some type of activation, some type of warm up, right? Where they're kind of getting a stretch while they're warming up.
Right.
Right. They're activating the things that we are going to get into. And then we'll start getting into doing some weights or conditioning. And if I see that they're moving in a way that mechanically isn't correct, we'll stop, help mobilize that area so that we have a focused area that we're working on, not just general, right? So we can say, hey, your hips are tight today. You've been sitting and commuting all week. We need to open up your hips because it's hard for you to squat, and I can see that. So it really kind of depends, and it can be changed from day to day, from week to week, even in the same person.
And you've mentioned on several occasions it depends on the client, the goals, et cetera. I believe, if I'm not mistaken, you work with elite athletes and also people who are not athletic at all.
Completely.
So everybody's different.
Completely.
And you mentioned different age groups as well. How do you measure outcomes?
Yeah, I mean, again, in your relation to that, if it's someone who is trying to lose some body fat or some weight, right? We're going to take their body fat percentage. We're going to take measurements through typically 5 to 7 points of their body, so they can have some hard data to look back on. Because sometimes that scale doesn't move quite as quickly as we'd like it to.
Yeah.
But if we can show them, hey, 3 weeks ago we were here, right? And now we're here, and in terms of your body fat, and explain to them in a way that they can understand just what's happening not only on the outside but inside to their body and those physiological changes. That can pay off as well. Keep them motivated to keep coming back so they can see that scale go down, see those inches go down, and just overall feel better.
Well, obviously, if somebody is working with a Justin Gray at an elite location where you really have the finest equipment, that would be the sort of ideal in terms of pursuing fitness goals in this new year. But I'd like to ask you a little bit more broadly about people who may not want to do that, people who might be at home, who may not have a lot of equipment, but they still want to get into shape. They maybe are concerned about their weight and overall energy level. In the absence of going through a formal program or going to a gym, do you feel that they can also get in better shape, and what would you advise them to do?
Sure. I mean, I think you hit it on the head with that one. There's a lot of people just don't feel comfortable. Maybe time-wise, they don't have what they feel have the time to. But as long as you're getting out and moving, I'm happy with it, right? It's less about the exact precise thing that you're doing. It's just getting out and moving, right? Again, going back to nutrition, some things, there's some real benefits with the accessibility online now of being able to log your food. You don't need to see a coach. You can just download an app and start downloading what you've been eating so it keeps you on track there. Get outside, go for a hike, go swimming. Any of those things are good. Get your heart rate up, right? And just start to be mindful of your fitness and investing in your health. Right? I think too many times, especially nowadays with everyone being busy, long work hours is, health and fitness can kind of be reactive, right? We wait till we're hurt, till we're sick to be doing something instead of investing kind of in your future and looking at it as kind of a long-term play.
Okay, let's talk about some of the things that you might have learned from coaching and teaching people about lifestyle. You mentioned first sleep before nutrition. What sort of shortcomings do you see in people in terms of their sleep habits, things that could be improved upon in this? Well, we're in a hectic society. People have to get up to go to work, obviously. But do you see particular problems that you can correct through your educational interventions?
Sure. Yeah. I mean, just there's tons of data out there and saying that just even missing a few hours of sleep a night can have a detrimental effect on your body, cognitive function the next day. If you are active and exercising, how your body recovers. Every few hours that you lose of sleep the night before, your body recovers at a substantially less than it could if you got 7 to 9 hours of sleep, right? So if you're starting a new workout program, we're getting our nutrition dialed in, but we're still not sleeping enough. We're kind of burning the candle at both ends, right? We need our bodies to recover. And our body isn't recovering right when you're working out. It's recovering that night when you're sleeping, eating right, feeding it, right? So all those things need to work in conjunction, or else that's not going to last very long.
Do you have any opinions about the sleeping environment, the mattress, the pillow?
Those things to me is kind of unique to the person, right? But some of the best things you can say is, hey, it needs to be a dark room, not a ton of distractions, even, little lights from the TV or people going to bed, staring at their phone. Even if they fall asleep, it's been shown that, later on, they're not going to get into deep sleep for another 2 to 3 hours. So their quality of sleep won't be as good as it would if you just shut those things off good 45 minutes, an hour before you go to bed, right? Kind of environment is going to be, they find that, hey, cooler is better in some circumstances, but it can depend on the person. Yeah,
I really think as a society we're practically all sleep deprived. I mean,
totally.
If you look back at the way society was before we had cell phones and the internet and so forth, and even going back to the period of time 100, 150 years ago when there weren't as many lights, I think people tended to sleep a lot more and they would go to bed at a regular hour and get up at a regular hour. I think there's good medical data to suggest that when people disrupt their sleep-wake schedule, whatever it happens to be, it can have effects on your concentration and everything. So I totally agree with what you said.
I mean, there's a lot to say about your sleep cycles and even the effects to the microbiome. How you can process things, learning new things can be slowed down by less sleep. There's a very, very small percentage of people that can function on that 5 to 6 hour range.
Right.
But we're talking about like a fraction of a percent. So for the most of us, even though they may think they can do okay on 6 hours of sleep, imagine what you could do on 7 to 9.
Right. And on nutrition, which we also discussed before getting into the exercise part of things, obviously, we've discussed that that's a problem for many people, particularly in the United States. Without, getting into meticulous detail, do you have any general guidelines that might help people who are, fighting the battle of the bulge, trying to remain fit as we enter this new year, just in general, realizing everyone medically is different and so forth?
Totally.
Yeah.
Totally. Genetics and all those are going to play a huge part in
Right.
it. But I think the best way to go about it is what you had spoke to in the beginning is it's a kind of a cultural thing now that we're all on the go, right? I think to help this, we need to kind of get back to that families eating meals at home, cooking your own food, not just going with the easy way out. Yeah, I've worked 8 hours, now I've commuted. I'm just going to swing by and pick up something that's frozen or through a drive-through. Take the time, invest in your health. Go ahead, go home, spend an hour that maybe you're not going to spend at the gym. We'll spend that hour cooking good food for your family, right? Whatever that diet is that you want to go on, it needs to be something that is sustainable. Those things that, it's a month quick blast diet, they're not sustainable, right? You want something that you and your family can use forever, right? And you don't want to demonize food. You want to have a healthy relationship with it and understand that, hey, I'm setting not only myself up, but the rest of my family up in their patterns coming up. Those of us that have kids, you're setting the patterns for your children. And that's what they're going to take. And they could very well be passing that on to their children. So it's a bigger picture when you look at it that way. And it takes time and it takes effort to go in and do those things.
We teach by example, in other words.
Completely.
In terms of roadblocks, I know you work with people of different ages, younger and older people. Do you encounter very many injuries when you're training people? How big of a problem is that for you?
Yeah, I mean, in regards to injuries or just tightness, it's all the time, right? I mean, there's very few people that I work with that just move perfectly, right? It's either that they're tight, something's been injured from the past that they've never addressed, maybe something is aggravating them from something they've done earlier in the week. I teach large classes, and in a class of 30, probably 8 to 10 of them, I'll have to give them some type of revised workout because of injuries. Most of the time, I'd say 80% of those happen outside of the gym, right?
Yes.
It's something that's happened, just in daily life that we're trying to address. So if you're looking at it as at the gym, a pretty small fraction of those injuries are coming from something they sustained in the gym. But again, it's kind of my job as a professional to give them ways to work around it or address those first before we go ahead and have them do anything that might aggravate those injuries.
Well, I know that you're very conscientious about stretching and being safety conscious, but of course it's a question worth asking because people do periodically have injuries, so obviously you're attuned to that. You mentioned that you teach group classes as well. If anyone in our viewership wishes to get in touch with you, is there a website or an easy way that they could reach you?
Yeah, I think if you're ever in the East Bay or Contra Costa area, going into the UFC gym is probably the best way of just coming in. You can always reach out to myself. We can take a tour and kind of see what we do there, because it is kind of a unique situation.
That's great. And also, as we look to the future, do you feel that there are new innovations in personal fitness or lifestyle training that give you a sense of optimism as we look forward into 2020 and beyond?
Well, I think there's a lot of good out there in the sense of online. There's so much information out there that's at our hands, right? And it can work in both good and bad ways, right? Never has there been a time when it's easier to find motivation online, find workouts online, nutritional things. But then you have to kind of weed through some of those things that may not be 100% correct. So getting with someone professional to help you weed through those things, like myself, can help kind of streamline that and get you to those goals a little bit quicker. So yeah, there's a lot out there that can help us, but I think it really comes back to taking the time for us to get back to preparing our own food, right? Taking the time out of your week to maybe work one less hour, or turn the computer or the TV off a little early so you can focus on yourself.
I was going to ask you, as our time is running to a close, if you would like to give any closing advice or recommendations, but you've given so many great insights already. I don't know how much more there is to say, but as people are trying to sort of psych up to pursue fitness and health and just trying to get going through that first step, do you have any closing advice or recommendations for our viewership?
I would have to say, it's a great question. Start now. Don't wait to some arbitrary date. If you're thinking about it now, you can make the decision to eat something better for dinner. Throw your gym clothes in your bag for tomorrow. Get out for a walk on lunch. Start now, because you can make a lot of progress in a couple of weeks instead of putting something off. And that's what I see a lot in this time, that we all think that, hey, January comes around and everybody is instantly in the gym. It takes a few weeks for people to kind of get their mind wrapped around it. Start as soon as possible, get moving, eat nutritious food, get plenty of sleep, and you're going to be in a good shape.
And some people who want to pursue this on their own at home, often this time of year people end up buying exercise equipment. Often a month or two later you see it at a garage sale.
True.
But do you think it could be helpful to buy some exercise equipment? And if so, what would be a good piece of equipment to invest in?
I think that's a great question. You start small. You don't need to go out and spend a few $1,000s on equipment. Go to your local garage sale or a place where they sell some exercise equipment in consignment. Pick up a few things, a pair of dumbbells, some bands, anything of that nature where you can just start moving and do it safely is beneficial.
You know, I've seen so much equipment in people's houses and garages and so forth, and I've kind of come to the conclusion that going to a fitness center, it's not just about the equipment, it's also about the friendships, the relationships, and the whole environment. And that there's something about working out alone at home that can be particularly challenging for many people. I know some people who seem to do it well, but it seems like there's something about pursuing these challenges with the support of not just lifestyle and fitness coaches, but just friends that maybe makes it easier. I don't know if you agree with that.
Yeah, that bit of community is what keeps gyms in business. Right, like you say, anyone can just go out and buy some equipment and do it. But it's the motivation of knowing that some friends or some friendly faces will be there at the gym when you get there. So it's as much of a social benefit as it is a physical benefit, and that's what will keep you coming back.
Well, Justin Gray, it has been such a privilege and pleasure to have you here. As I mentioned, I've known you over the years, but I haven't personally trained with you. Probably I should have, but just because we're in different locations and I have a different routine. But your reputation is really excellent as a person who just knows this field and cares about the people you help. So thank you for all you've done for the community, and all of us here at Health Focus wish you the best in your future endeavors. And come back and see us again.
Thank you. Thank you for having me.
Remember, here at Health Focus, we focus on your health. As we enter this new year, 2020, all of us here in the studio hope that you can pursue health, fitness, minimize that stress, and have a fantastic 2020. And we look forward to seeing you back here again in the future. In the meantime, stay healthy out there, and thank you for joining us.